Hey guys, welcome to the very first Integrated Vitality podcast, where we will be discussing all things health with a focus on neuroscience, integrative and functional medicine, alternative medicine, and personal growth. And today we're very blessed to have the one and only Dr. Perry Nickelston joining us. Dr. Perry is an absolute powerhouse of knowledge and wisdom, having been in practice for over 25 years and is one of the leaders in teaching us all about the lymphatic system in health, amongst many other things. So, Dr. Perry, welcome to the show.
Thank you very much, my friend. I'm truly honored to be on. Yeah. First one, congratulations. That's
Thank you,
wonderful.
Mate. Well, we hooked a big fish for the first one, so thank you.
Well, I hope I don't disappoint. You know, it really brings back memories for me. I remember the very first time I started my podcast. I probably about 8 years ago. I think maybe I was early into the scene, but it's hard to believe it's been that long. And it's really, really fun to have one. And I started to have my shows just because I wanted to talk to other people that were way smarter than me, but then share that with the world. And it's really, really fantastic. It's nice to be on the other side of the mic. So I appreciate you asking.
Thank you, mate. Thank you. Now, just why don't you start by telling us how you got to where you are today and why you do what you do in the way that you do?
Oh, great question. Well, probably like many people listening, especially if they're into healthcare or the fitness profession in any way, it's through my own suffering, really, or the suffering of maybe someone in your life that you care about. And, it pushes you to discover why you're suffering and why you can't get better, and looking for answers that's very often you don't get. Unless you do search on your own. So I got into chiropractic, which was my quote unquote degree to be able to practice in healthcare like 25 years ago, like you said, because I was a bodybuilder. I was lifting really heavy stuff up, putting it down lots of times, maybe not the best form either. I'm 53 years old. I remember I started bodybuilding in like the 80s. So I'm like old school, man. And the way we look at fitness and training and functional movement back then, there was no such thing, you know. And I hurt my back doing a deep squat, and like most people, even today, we say, "Oh, well, that sucked, and I'll just rest, and maybe it'll go away." And it did for a little bit, but then, holy cow, it came back worse than ever. Imagine that, right? And then I just couldn't get up off the floor. And then my training partner at the time said, "You should go to my chiropractor." I'm like, "Chiro what?" Like, I didn't even know what the hell they were. And the guy put me on a table, did manipulation on my lumbar spine and my pelvis, and I stood up, and I'm like, that's some really cool stuff, man. And it wasn't until like years later that I decided to become one. Just kind of going through like a professional career crisis at the time. And that led me down the road of getting into chiropractic. And once I graduated, I honestly really wasn't happy with what I was doing. I felt like I was just treating people in pain all the time, and which is what you're doing, right? But they would keep coming back with the same problem all the time. Like no matter what I was doing, they'd feel better for like a little while, or maybe not at all. And I would have to see them so much. Like I don't have to see somebody so many times to try to get the body to make a change. It's very frustrating. And I realized that, okay, what does everybody have to do when they leave my office? I'm trying to look for some creamy filling, I call it. Well, they got to move. Movement's probably important, right? So that led me down the movement road and getting involved with that. And then the movement road led me down into more of the nervous system road, which led me down into the brain road, which led me down into that's a rabbit hole in and of itself, right? Yeah. Studying this thing up here, which is kind of like the most amazing thing in all of the universe that we haven't even begun to tiptoe into. So, and then I got sick about 5 years ago with the autoimmune disease, like so many other people in the world. And that led me into the stuff that I began to discover now in relationship to quote unquote what they call functional medicine, or looking holistically at the body in a whole different way. And then really wanted to grasp the immune system and its function in relationship to chronic disease, but also chronic pain, which was a very cool discovery on my part. And then that led me to the lymphatic work that I really do right now a lot, which I'm sure we'll discuss. And then what's really cool, man, is how like everything comes full circle, because now we're seeing when we talk about these neuroimmune inflammation in the body. Neuro means nerve, immune. So these systems always work together.
Yeah. Yeah.
But now we're seeing them in a light that we've never been able to see them before, because honestly, we have the technology to be able to see things in the body we could not even conceptualize before. Hence the functional MRIs and stuff like that with the brain and all sorts of cool things like that. Though, I mean, that's kind of like the nutshell of what brought me to where I am now, and I'm continuously learning. But the short and sweet answer is because I got my ass kicked like a lot.
Sounds
You
like a
know?
pretty normal story. Can you, because you've really dived deep into the lymphatic system, and I've definitely learned a lot from you about that and the importance of that. Can you sort of give a bit of a rundown on what that is and why that is so important, and how it interacts with, say, the gut and the brain and the nervous system?
Sure. Yeah. Well,
And the
great
immune
question.
system. Yeah.
Yeah. Well, I mean, it'll tie into the brain too, right? Once I tie it all together. But honestly, let me tell you like my journey into it. I never even thought about that system in my whole professional career. And even when I was sick, and until I just stopped I couldn't make any more progress with everything that I was trying to do. And I was just very frustrated. And then I was actually at a course in London, and I had a lot of symptoms where it's very puffy, very bloated. I was sniffing a lot, had a lot of sinus issues, postnasal drip, brain fog, fatigue. And I'm like, "Dude, I'm trying everything to get well. I have no idea what's wrong." And the guy said, "I know exactly what's wrong." And I go, "Really?" I go, "Yeah." So he brought me over, and he stuck two fingers, actually. I know some people may be watching on video. Two fingers right at the top of the spine on either side, right behind the angle of the jaw, where what's called your C1, the first vertebrae exits. And he pressed right there on both sides, and it was the worst pain I ever felt in my life, man. That's where the largest lymph node sits in the neck. And he said, "You got a congested lymph system." And just like with chiropractic, I go, "Lymph what?" Like I didn't even think about it, right? Because in chiropractic school and med school, you spend like, I don't know, 15 minutes on the damn system, and then you skipped over it because nobody even thought twice about it.
Yeah.
And then he just did a little bit of just assessed my lymph nodes. After he assessed them, the next day I was like, "Holy cow, man, I like feel so much better, even just from that." And yeah, I'm like a dog with a bone when I grab onto something and I wanted to learn more. And so I just started to investigate it and found out that, to me, it's the most important system in your body that most people are not even thinking about or talking about in relationship to being able to reach your full health potential or restoration. And I find it's like the biggest block that's there that people don't know is there, that they need to work with. And basically why it's so important is it's the sewage system of the body, which means it's designed to get rid of a lot of different things that come out our way called toxins. And we get more toxins thrown at our body today than ever before in the history of man, because of just the industry and the environment that's around us, not to mention the ones that you can't see through the Wi-Fi codes and the EMFs and the phone and stuff like that. And it's supposed to get rid of viruses, which people know a lot about right now, bacteria.
How does it do the viruses? How does it do the viruses?
Same way, same way. So we'll kind of get into that in a minute, but it doesn't matter what the toxin is; it's going to go through the lymphatic system at some point. So it's bacteria, it's viruses, it's parasites, it's fungus, and it's also cellular waste and metabolic waste from your cells breaking down through normal life, so they can regenerate and make new ones. And it gets rid of a lot of the protein in the body, excess protein in the body, because your body actually doesn't like protein. And it's supposed to get rid of all that stuff so it doesn't stay in your body. It needs to get out. And that's the number one primary system that does it in relationship to a lot of other ones. Some being your skin. Every time you breathe, when you go pee and you go poo, right? All those sorts of things are detox of the body as well. And I tell people this: imagine if you were going to the bathroom in your house, and you do what you got to do, and you're supposed to flush the toilet, right? And then everything leaves, no harm, no foul. You're like, you don't see it anymore; it's all good.
Hmm.
And that's what your lymphatic system is supposed to do. It's supposed to get rid of the stuff in the toilet. And imagine if you went, let's say you're 30 years old, nobody ever told you how to take care of your toilet, and you've had a backup toilet for 10 years. It's probably going to be pretty nasty inside your house. And the same thing happens to the human body. It breaks down slowly over time because it's living in its own toxicity and waste. But it's really good at trying to adapt and survive. And what it does is you really don't know that that's happening. You just slowly start to feel like crap all the time. You have pain all the time. You're tired all the time. You have fatigue all the time. And then you got brain fog. And I've got what everybody else has got. It's just normal. And I'm like, no, it's calm. It's not normal at all. You're supposed to be happy and joyous and energetic and vitality and not have autoimmune and chronic disease and all that bullshit. And then no wonder it just comes up slow, right? Like bam, like one day I just automatically am quote unquote sick. And what I'm saying is you need to just go in and clear out the toxins like you would clean out your toilet in your house so it works again. You have to do the same thing with your body. If you don't reset that system, what I found is that everything else you're going to try to do to heal yourself won't work as well or won't work at all.
Yes.
I mean, that's super. I mean, I'm trying to get across to people. That's ginormous, man, what I'm telling you here.
Yeah. I have seen that in clinic. I have seen it sometimes. I work with the brain a lot. And sometimes even just trying to get a correction to hold it on that level won't work. And I'll look at the lymph and do a lymph clearance, and then everything will just start to turn on, and they can start to work again. So it's pretty important.
Yeah, because I mean, so many people in our industry don't know, and most humans don't know, and our industry didn't know for a long period of time, or claimed that there wasn't any lymphatic system that was in the brain to detoxify the brain. And now we know that that's incorrect. That there is a special system in the brain. It's actually a couple of them that's supposed to drain the toxins from the brain, right? I mean, I don't want toxins around my brain cells all the time, right? And it's actually really funny that you look back on that anybody would actually think that Mother Nature would be stupid enough not to give a way for your brain to drain itself. And that's just something where, here's the thing with the system was always there. It's always been there. We just didn't see it, but that's even incorrect because they saw this system a couple hundred years ago.
Chinese medicine.
Yeah, they just saw it, and then they just discarded it. It gets buried in the thing, or if it gets the current dogma of the day, and then all of a sudden now later on they're like, "Guess what we found?" I'm like, "Oh, hold on, not so much. Like it's been there." But now they're really doing a lot of research on it, which is great, and then they can actually see things with the technology of today. And then we as humans are always like, I don't believe it until I see it, kind of stuff. And so I mean, at least that's the good part that's coming around. And the brain lymph is directly tied to the ability for the quote unquote body lymph to drain. They're not separate systems in my world. I mean, think about that. I mean, anybody who thinks you have a separate system in your body, I don't know what planet they're living on, but it's not Earth, right?
Yeah, I know. Just talking about the brain's lymphatic system. Are you talking about the glymphatic system, the one that's linked with the glial cells in the brain?
Yeah, the microglial cells. Yeah, that's a big part of that one. And then they've got some that they know functions through the cerebrospinal fluid, the CSF. Yeah, that one. So you got the microglial ones, and you got the cerebrospinal fluid, and those drain out from the brain, and they go down the neck here to back to the heart. So they have to drain. They have to drain to the lymph nodes that are in the neck, the deep lymph nodes that are in the neck. And if those deep lymph nodes are overloaded or swollen or not working efficiently, and most of the time they are, then the brain can't drain its lymph as well. So then it just stays up there, and it's trying to get rid of it. And the brain, they found out that at night when you sleep, your brain actually shrinks up a little bit. The cerebrospinal fluid, that's the fluid that floats around the brain and around your spine. It kind of does like a power wash on the brain, right? And then it's going to get rid of the toxins and then drain down through the neck to go out, so it can get out of your body.
Yeah.
But if that's stuck, you're going to power wash, and you're just going to move what around in your brain all the time, like more toxins.
So then you'll wake up with like brain fog, basically.
Yeah, and you'll have what everybody is today, living in a damn stupor, right? They're like brain fog, and memory goes, and a loss of fatigue is one of the first signs of inflammation in the body. And then memory is another big one. When you lose your memory, that's going to be a huge part of that. And then now everybody's getting these neurodegenerative disorders of all kinds, from Parkinson's to Alzheimer's to attention deficit disorder, ADHD, all these brain type issues. And I'm thinking to myself, well, if you're living in a toxic environment in your brain, your cells, of course, they're going to be affected, and you're gonna lose the ability to have them function optimally the way they need to. And then we know that you've got a connection between your brain and your gut, your intestines, right? They call it the gut-brain axis in our world. And we know that those two systems talk to each other both ways. The brain talks down, the gut talks up, and then they communicate with each other all the time. And then if you have any underlying inflammation in your gut, particularly in your intestines, which everybody does. Like people say, how do you know if you have gut inflammation? I'm like, that's very easy. You're breathing. You're alive on this planet. There's no way you can eat the crap that we call food and go through the stress that we go through in life and not have a gut that's got a big issue. It's not possible. It just depends on how bad it is, honestly. And then when that gets inflamed, then that's going to inflame the rest of the body. And when stuff leaks through the intestines, which are not, they're supposed to have a nice barrier through it. Some's supposed to get through, not a lot. And then stuff leaks through, and then the immune system has to kick into play to try to attack stuff that's leaking through the gut that's not supposed to leak through the gut. So they call it leaky gut. And I'm going to give you one guess at which system is the first one there to attack it. The lymph. Right. It's called gut-associated lymphoid tissue, GALT.
Is it GALT?
So GALT, that kicks in right away, and you get your immune system inflammatory response, and the GALT communicates with all the other lymph in the body. So everywhere else gets kick-started because it's a connected system that way. And if you have gut inflammation, you'll have brain inflammation. You can't have one without the other.
Exactly.
In my world, it's not possible.
Yeah.
So if you have brain issues, you have gut issues. You have gut issues, you have brain issues. You're like, which came first? I don't care which one came first. All I know is that now we have to repair both of them together. So you can't just do brain work to try to get people better who are suffering from autoimmune diseases, but also not only that, but if they have a coordination issues or movement issues or what we call it, inflammation issues in there. You have to work with the gut as well, because you need to make sure that the brain can function at optimum. So you can, when you're trying to get these new connections for the brain cells, that you can change a movement pattern or change pain. From there, you have to be able to do both, because I'm sure we'll get into the role of pain in the brain and things like that. And now they're finding, which is quite fascinating, is that Parkinson's disease, which is the degeneration in the brain, starts in the gut long before it ever manifests.
I've seen that research. Yeah.
So, I mean, it starts there. That's why most Parkinson's people actually have constipation. So they'll have constipation. And when you can't get, here's another thing, if you can't get rid of toxins, that's your poop. If the poop sits inside of you, your body doesn't like that. I mean, because it's gonna what? It's gonna make you toxic. It's gonna leak through the gut, and you're gonna start to rot. You're gonna get putrid. You're gonna get rot from the inside out. And usually, that's going to be tied to the brain anyway, because you can have constipation when your vagus nerve doesn't work well from the brain down or the gut up. And so there's always this gut brain axis that is really important. And so I always, with anybody who comes to see me with chronic pain, if you have chronic pain or an autoimmune disease, I know two things. Actually, I know three things. You got a gut problem, you got a brain problem, you got a lymph problem. You got all three. And then when you look at the lymph, so let me put it into context for you, because honestly, I teach workshops that are 16 hours long talking about lymph. Like, I mean, I could go on forever. But you've got over 700 lymph nodes in the body. Lymph nodes are kind of clusters where the lymph gathers, and then they accept all the viruses, bacteria, toxins, and then the immune system starts to break down anything that comes into it, and then it goes to the next node, and then that node attacks it, and then the next node, so it filters it down. So every time it hits a node, the body starts to kick its ass a little bit more.
Wow.
But you've got billions and billions, that's with a B, of lymphatic capillaries. They're the endpoints of the system. And those endpoints connect to billions of vascular capillaries. That's the blood flow that delivers your oxygen and nutrients to the cells that are trying to recover and regenerate. So if you have a lymphatic system problem, you have a blood flow problem. If you have a vascular problem and a lymph problem, you're going to have a nerve problem as well, because they always travel along nerves, and nerves need glucose and oxygen. If they don't get it, you're not changing a nerve for very long. And the brain needs a ton of O2, about 20 to 25%, depending on who you read, of the available oxygen in the body. And then you need a ton of glucose as well. And it usually doesn't get that because your liver's a hot mess because you're overloaded with toxins. So you have the 700 lymph nodes. 1/3 of that number, 1/3 of the 700 is from the neck up. So think about that. So what I tell everybody is that everybody's got a neck problem as well. And then the two other largest areas where you find lymph are in your skin. Your skin is one. And then the other one is your gut. Those three. Those are the big dogs in the room with lymph. And so you have to address them all. Every time.
And so what do you do every day for yourself to make sure that those systems are working? I know you put videos online on your pages, but what do you do personally every day?
Yeah, that's gonna. I could tell you what I do personally, but it's kind of individualistic in a way where everybody's going to be at a different stage with where their lymphatic system is. So, for instance, if I have somebody who has an autoimmune disease, I know they've got a pretty crippled lymphatic system that's there, and we need to go a little bit easier on working with them because their body can't handle a lot of stimulation to it, and they can be overloaded where they get even more. You're gonna when you work on the lymphatic system, you're gonna release toxins that have been stored, and you're releasing it into a system that can't handle toxins. So you have to go easy. So I have an approach that we do where we assess the primary lymph node areas in the body, the channels, and these are the areas that we go that I said before are at the top of the neck, kind of along the arm, the axilla, around the breast tissue and pec. Hence why women get a lot of things with breast cancer because the lymphatics right there. Then we go along the sternum and the abdomen, and then the crease of the groin. And then behind the knee, and we go those big major places to check for sensitivity, swelling and inflammation, pain, and also patient reaction to things. And so the more of those areas that I touch that are tender or painful, and based on your symptoms that you have, then I know what I'm going to need to do with you. But we always start very superficial and very light on everyone. And then we can start to go a little bit deeper. What I mean by that is that we can work very close to the skin in the beginning, where we do a lot of dry brushing or light work on the skin. Some people have heard of dry brushing for your lymph, but you can do it by hand as well. and that works more of the superficial lymph.
That's just doing that, like a rub.
Yeah, like
Like
a
that.
rub. Yeah,
Mm.
and then we show other techniques because the program I put together involves a lot of stuff I've learned over the years with pain science and neuroscience and how skin stimulation and sensory awareness and stuff like that. So I'm trying to impact not just your lymphatic system, but your nervous system as well, and also your brain and its response to going in too fast, too hard, too soon, or what we call perceived threat. And
Yeah.
then
Yeah, we're going to talk about that
then
for sure.
yeah, and then so I'll see if you detox at all, and if you don't, I'm like, okay, well then I can get a little bit more aggressive, and then I go with a little bit more pressure maybe, and then I'll go to the deeper lymph nodes that's got congestion in there, and that takes a little bit more advanced training because you have to feel comfortable pressing deeper into the body, particularly around the abdominal region, and a lot of people don't feel comfortable doing that
Mm.
and getting in there. But you'll find out that if the longer somebody's had a lymphatic problem, you're going to need to go deeper. And then I also teach you how to release the lymph around the brain. So I do a
Mm.
special technique where you release the neck and you release the face, but then I show you advanced what we call cranial work. So you shift the bones in the skull a little bit, and you work with certain parts of your spine that can begin to help move that fluid. And so there's advanced ways that we can flush that system a little bit more aggressively.
Yeah.
And then it can take you, honestly, a couple of months to get back to where you need to be because long-standing lymphatic issues usually take years to develop. But here's the thing that I've learned as well, because it happened with me, and I saw it happening with many people who have like fibromyalgia, chronic fatigue syndrome, whatever label you want to put at it, it's all the same. It's inflammation. But they would sometimes get worse even through my program. Like they were just not progressing, or they would get better, but then the inflammation would return. And then they would be like, this doesn't work. And I'm like, no, it's, it should change pretty significantly when you work on a system. It just means if something keeps coming back, there's something missing.
Yeah. Yep.
Yeah, because I always look at the body. Things should change pretty quick if you're on the right path.
I have the exact same philosophy. So
yeah.
If it's not sticking, I'm either missing something, or there's something deeper, or there's some other thing that we haven't seen, because things should generally change quite quickly. So do you want to talk about that quickly? Like how do you work through that?
Yeah. So, I mean, that kind of brought me back to my frustration early on of chiropractic. You'd see people 3 times a week for 4 weeks, and, maybe we'll get better on the 3rd week. I'm like, oh, no, I just never set well with me. So, I think everything should happen at the speed of neurology. It should happen really fast. Like if you give the body what it wants, it'll tell you quick, fast, and a hurry if you got it right. If you don't give it what it wants, it'll tell you that too. And, pain is a request for change. Pain is telling you, I need you to change something. And to me, it's like, change what you're doing, your habit or behavior, even with what may have brought you the pain, but what I'm trying to do to relieve the pain instead of just keep hammering at it. So I was like, there's got to be some reason. So the first reason that I discovered was because the person's immune system is still overreacting to something. Like it could be something that it's still trying to attack.
Like an infection or something?
Yeah, usually it can be. It's what we call a stealth infection. It's actually an underlying viral load that they call a stealth infection.
Yeah.
Or an underlying bacteria. 2 of the biggest stealth infections are herpes virus 6 and then Epstein-Barr virus.
Yeah.
Those are the 2 like big ones.
Yeah.
And the body's always trying to fight that. And so you've got that one, or they've got underlying some fungal infection or bacterial infection, like don't know about. So a lot of sometimes it can be candida, but otherwise it can also be the imbalance in the gut flora. Like you don't have enough good bacteria, you got bad bacteria, and then the immune system's kicking into gear there. But but also what happens is over time, people through stress or adaptations, their immune system gets what we call maladapted, which means it gets stuck in a certain response and it doesn't know how to get itself out of it.
Mm.
And, so it's stuck in this protective response. And so I don't look at it as a dysfunctional immune system. I look at it as it's working too damn good. Like, think about that. That's like a very different way of looking at the body. So they're stuck that way. And then I have to figure out, okay, well, what's driving that? And it's going to be different for every person. That's where you got to kind of get specific. And then if you can flip that switch, then get the nervous system to calm down a little bit. Then very often, then it'll say, okay, I'll let the lymphatic system rest. I'll give the lymphatic system a break because now I know I don't have to work all the time. And sometimes that's just, and what's really cool about this is sometimes it's just your body thinking that it's still perceiving a threat somewhere.
Yeah.
It doesn't even have to be, this is where it gets tricky because it doesn't have to be a real threat. But even if you think about something, it's still a real threat, whether you think it is or not, right?
Exactly.
And so it's always in this response mode of protection. It's almost like you got to smack it around and say, snap out of it a little bit. And those are the people that have usually been very sympathetic, dominant, high driven, always on survival mode, fight, flight, freeze, freak out. That's what people are in right now. So what you're going to see is a huge upswing in chronic pain. Autoimmune disorders are going to go through the roof right now on the ones that people have had diagnosed, or new ones will manifest themselves because stress is the biggest catalyst for chronic pain and disease.
100%.
And we got a lot of that going on in here.
Well,
so that was
I always
one.
say with most conditions, like we've got so many different conditions, and they're all basically neuroautoimmune if you really look at it.
Right.
And looking through the research a few years ago, if you look into the research, you'll actually see that underlying every single condition, no matter what they're called, whether it's cancer, Parkinson's, fibro, or whatever, there is excessive stress markers and there is excessive inflammation. Every disease. So
right, exactly, and it just manifests differently for different people, and then they just call it a different name. I think they've got 10,000 disease names. Like it's crazy. And so I just started, okay, well, I got to focus more on the immune system because that was a big one for me where I just learned to, had helped somebody get their immune system better under control. And that comes from many, many different factors, but, that was a huge one. And then the other one is that I found that when I was trying to stimulate the lymphatic system, people would actually be, the pump would reverse flow. Like I'm stimulating it, but it would go the opposite direction. It would backflow. And then that's when I discovered the fluid pressure systems of the body, and then how fluids change pressure based on, from the head to the torso to the lumbopelvic complex. So if I break up into like three to four big pieces of zones of pressure. And then that's when I started to do much more work with the brain and getting what we call the Craniosacral Pump working, where when you breathe, the cranial bones should move a little bit and then your tailbone moves a little bit. And it's very subtle rhythm that moves this pump. And people, especially with fibromyalgia or chronic fatigue, they were usually sympathetic for a long time, and they would be locked a lot in the thoracic spine, a ton, very, very sympathetic dominant with the system. But then this pump would become dysfunctional.
Yes. And
then the lymphatics would actually backflow through the channels.
Makes sense.
And then they would either not get well, get worse, or continue to stay puffy. So then I learned to check the mechanism of the pump.
Yeah.
And then I restore that. And then also now work with the immune system of the body. So now what I do on everyone is I always work with that craniosacral pump on everyone first, because I find it is such a big underlying issue on most humans. And that's more from the world of osteopathic type medicine.
Osteopathy, chiropractic, applied kinesiology, all work with that sort of stuff.
Yeah. So, I mean, it's really something I've gravitated towards over the years, because I was so bad with my autoimmune disease, and I had such significant brain inflammation that I was I was heading into Alzheimer's type uh, symptoms where I couldn't remember like what I just did. And I had to
Mm.
stop teaching. I had to leave teaching and I had to close my office because I could barely function. And
Mm.
I was exhausted. I was sleeping for, I don't know, 15 hours a day. And then I just couldn't put a sentence together anymore. And it broke my heart because teaching is what I love to do. And I remember I always share this story because so many people come up to me and they say, thank you for talking about this. But I knew I needed to find answers. And I wasn't getting it from the traditional medical approach because their answer for me was just more antibiotics, more anti-inflammatories, and
Mm.
more surgeries. Every time I got one, I got worse. And I said, dude, I got to do something or they're going to kill me. Not on purpose, but through the damn lens they're looking at.
Mm.
And
Exactly. Yeah.
I went to the post office. I was mailing a T-shirt to one of my online members. I walked out, got in my car, and I'm like, where the hell are my damn keys? I can't find my keys, right? How many times did we do that? Can't find my keys. So I looked everywhere, and then I stepped out, and I traced my steps back into the post office. Nobody turned them in, and I walked back towards the car, and I kid you not, I was about 3/4 of the way back to the car, and I actually physically, I heard the car running. Like, I had gotten in my car, like started the
Wow.
car, and didn't
Wow.
even realize I did that. I didn't even have the sensory awareness that the car was running. And I left and came back, and I was like, "That's the kind of stuff that hits you with Alzheimer's. That
Whoa.
people can't even remember what their wife's name is or where they are. So
Yeah.
that stuff is real, man, and it scared the hell out of me because I can deal with almost anything, but losing my brain, I can't. And it tied everything back to me as well because here I am. I'm here in the world trying to help people, and I'm trying to decrease pain in people
Mm.
and I'm trying to improve movement, right? Corrective exercise, functional exercise. And I'm thinking to myself, so I'm trying to do restorative movement and stimulation stuff to a brain that is overloaded.
Yeah.
And I'm like, there's no way any of that stuff's going to make a lasting change. And that's a very important word right there, lasting change, because you can make a temporary change in anything.
Yeah.
But if it's not sticking, I need to understand why. I'm never going to make a lasting change in movement until I clean out the brain and the toxins. And I'm not going to make a lasting change in pain because holy cow, now they tell us that pain is perception and pain is actually in the brain and pain is an output signal from the brain. So I'm like, well, maybe I should look at keeping the brain pretty freaking healthy, right? And so then I started to look at the role of the lymph and the role of the toxins. And then I came across a phrase in osteopathic medicine that's my central tenet for whatever I do now. It's very, very simple. Drainage precedes supply.
Mm-hmm.
Drainage precedes supply. That means drain the toxins first, then supply with stimulation and nutrients second. And what we're doing is we got it backwards. We're trying
Yes.
to stimulate everything, which is great. But we got to remember that 90% of the brain is designed to not stimulate shit. It's like designed to
Exactly.
stop stuff. And then you got a brain that's inflamed, and then people hit a wall very fast, and they're doing all these movements, all these correctives, and people hit a wall, and their brain shuts off, and it can't learn because it's fatigued too fast. But then I'm trying to pump in supplements. I'm trying to improve your breathing, and I'm trying to give all these great things to make your cells better. But they can't take in nutrients until they get rid of the metabolic waste and the toxins that they're living in first, because they can't get to the cell because of the crap around the cells.
Mm.
And to me, I'm looking at this and I'm like, this is what I've been looking for 25 freaking years. And it just blows my mind that medicine doesn't see it. And when I look at it, I'm like, how can you not see what I'm seeing? And it's my goal in life to try to explain that fundamental process, because we're looking for all these causes of diseases, right? Particularly chronic disease, right? You have to keep in mind, like infectious disease is going to be a little bit different than chronic disease. But even when you get an infectious disease, depending on what type it is, I'm not talking about Ebola, for goodness sakes, but like a cold or something, you're supposed to get it and you're not supposed to have it. You're supposed to get it and then just become better. It's like, puts it away. So I'm like, okay, well, it comes to two things. So here's it in a nutshell. Chronic disease occurs when you lose the ability to make new cells that work. Because if you could make new cells that work, you wouldn't be sick, right? You wouldn't have pain. And you can't make new cells that work if two things are happening. One, you got too much of something. You got toxicity. So too much stuff coming in or not enough stuff going out. You follow?
Yep,
too much coming in or not coming out. Most people have both. And then you have to have the nutrients. So toxicity and nutrients. So it's toxicity and what I call deficiencies. That means you're lacking something. You got too much of crap and you're lacking something else, usually nutrients, glucose, and oxygen. Yep. So what I got to do is I got to take care of number one first. That's the key. I got to take care of one first. And then two becomes way easier. And most people been banging their head against the wall at number two. And that's good that you're doing number two. But you got to do number one first. That's all I'm trying to teach people. You got to do number one first. And the lymphatic system is one of the most powerful ways that you can begin to do that. It's at least it's a starting point that somebody can go after. And that's kind of my mission, is to try to show that two-step process and give them a system to be able to try to approach that. And hopefully that makes sense.
That does make sense, complete sense. I mean, you see that in the world a lot, where people are still trying to do. It's always about doing, and stuff coming in, stuff. So that can be what they're eating. That also could be, the stimuli that's coming from, watching TV or watching, Instagram, lots of stuff. It's always stimulation, or they're always, they're over exercising. They don't get that that minimum effective dose principle, which is about finding the right thing at the right time,
right,
and just enough. So do you use that in your office, that minimum effective dose sort of?
Oh yeah, well, there's a few things that I've discovered that cause, in our world we call it therapeutic failure, which means you're trying a therapy and it's failing. One, it can be because you're doing the wrong damn therapy, first of all. Or maybe you're doing it. Maybe you're doing it to the wrong body part, or maybe you're doing it to the wrong system. I mean, those are like the ones that are obvious. But there's two that I found that few people recognize. You do. That's why you have such great success with the way you look at the body and you treat people. And you've already mentioned a couple of them. One is that we do too much. Like we do too many things at one time because we're trying to do great things and we're like, more has got to be better. I'm like, no, better is better. Or even if we do a few things, we do too much of those few things. And then we get overloaded. And then the body just says, dude, I puts the hand up and says, I just can't take it anymore, right? So you got to learn to recognize the signs that the body's sending you that it's too much. And it's not always hashtag beast mode badass monster, which means it's not always hard, go, go, go with the work that you're doing. I learned that a lot when I started to work with the brain since I had mine, because I could literally only start to do some drills for me, especially when I started to do like working with my eyes for like 2 minutes and I had to sleep for a freaking hour. Like I was just shot.
So you probably overstimulated yourself.
Yeah. I just hit the wall, man. Yeah. And because the vision takes a huge amount of energy, right? I mean, massive. And so it's too much. And then plus, if you're doing all those things, I found that some people are doing things that would counteract the other thing that they're doing.
Yeah.
Right?
We've all been there. I've been there as a therapist many times.
Oh yeah, I know, right? And then you're like, but then it's like you're doing too many things, and how do you know what works or what doesn't work?
Yeah.
It's just a lot of like, just do one thing and see what happens, and then do this and do this. So it's too much. And then the other one, which was a big one for me, that I learned by studying the systems of the body, but also systems in general. How how things work.
Yes.
So I have a son who's studying to be an engineer, and I found it fascinating because I started to think more like an engineer and less like a healthcare professional, less like a doctor. And engineers look at systems. They look at, okay, what are the parts involved? How do I need to put the parts together? What's the order? Here's the thing. What's the order they got to put them in for the most efficiency at the outcome? Because I'm concerned about efficiency. So then I started to look at order. And then that's when I found, okay, well, maybe if I'm doing 6 things, it's good to do 6 things, but I better make sure I put those 6 things at the right time. And this one needs to go before that one. Because if not, it's not going to work.
Yeah.
Right. So I found that people just didn't take the time to figure it out. Because first of all, you got to freaking think and you got to use your head. And, there's a lot of possibilities that it could be. And there's nothing more terrifying than the idea of unlimited possibilities, first of all. But that's why you're a clinician and you shouldn't be going through a checklist protocol that you got out of a freaking book that you read, because it depends on the person that you're working with, and you better think. So you assess and you reassess. Assess and you reassess. You get it wrong like a lot. I mean, you're going to get really good when you suck a lot. Like, you got to get it wrong a lot, and that makes you think. But not a lot of people want to think, which I found. And then so you got to get the order right. And that's how I started to look at the body.
The hierarchy?
Hierarchy, correct.
That's one of the things that really impressed me about you when you taught me in a course in Brisbane about 4 or 5 years ago, was the hierarchy that you had for the body. And then that changed how I thought about the body, and I started to develop quite a similar hierarchy and how different systems have a higher importance than others. So that's what you're going to talk about?
Yeah, very much so. It was a huge thing for me. I have it hanging in my wall in my office, and I teach it to all of my clients. And when they see it, they go, "That makes so much sense." Like, I know it does, doesn't it? And it just helps my thought process, right? Of knowing where to go. And I always have this quote with people. If people follow me long enough, they'll hear it, that no system in the body ever works alone. And no system ever gets injured alone. No system ever heals alone. But in Western medicine, that's exactly what we do. We break everything down and we go after this one system, and then that's it. But the body doesn't work like that. And we know it's a whole. And every system in the body is important. Otherwise, you wouldn't have it. Right? And they interact with each other. And the body's pretty cool, which means if one system doesn't work well, you got another one that says, "Dude, I got your back, man. Like, we're family. I'll do what I can to help you," right? And then sometimes you don't know there's a problem until very far down the line of dysfunction, because your body's just trying to protect you the whole time, right? But the hierarchy for me, I usually just show people it's a 1 through 9 step process. And I usually start at the bottom. And the bottom is called site of pain. That's where you put your finger and you point. Like,
so if you have a sore knee or something.
Yeah, so that's the bottom of the hierarchy. That's the least important part of the puzzle. At least in my world of chronic pain, right? If it's an acute pain, like, dude, I just got hit in the knee with a bat, you're not going to pay attention to my damn hierarchy. You're going to go to the hospital and get your knee put back together. But you're going to look at my hierarchy if you have complications after that, which, trust me, you probably will if you don't get the right rehab. So the site of pain just tells me that you have a problem. It doesn't tell me what it is. So I'm going to do something to where it hurts, because your brain expects me to do something to where it hurts. But in my world, I know I'm going to start at the top. And number 1 is the brain. So I've got to work with the brain itself. And the number 1 way I work with the brain is, I've talked a little bit about it already, but is to work with the vagus nerve, which is the nerve that it relaxes your body, puts you into a parasympathetic state so it can begin to heal. So I start there to take down that stress response that you have. So number 1 there. And then number 2 is lymphatic. So I usually will start everyone with brain stuff, but I'll also do lymphatic stuff, because the number 2 will bleed up to number 1. and the number 2 will bleed down to 3, 4, 5, 6, 7, and 8. And I'm already doing something to number 9. So 9 starts to work its way up, 1 starts to work its way down, and we meet in the middle. And what most people do is they start at number 9 and they try to push their way to 1. And it's really hard to do that. And in my world, here's how I look at chronic pain. Chronic pain is, to me, is anything you've had longer than 6 weeks. I know there's no way in the world you could get to number 9 without going from 1 through 7 first.
Yeah.
9 doesn't happen by itself unless it's the bat on the knee. Got it? Like it's the chronic pain one. Yeah. So I have to address every single level, but I also know there's a hierarchy to the level. And people said, Doc, well, how did you come up with this hierarchy? I mean, what's this great wisdom that you have? It's really simple. I just think like the brain, and I think to itself. Okay,
think like your brain. I love it.
And the brain says this: if I have a problem with this system, is it going to kill me really, really fast, or is it going to kill me really, really slow? So anything that's going to kill the brain, which makes you dead really fast, that's more important to it. So at the bottom of my hierarchy is the side of pain, but the next level up is muscle, fascia, joint, and ligament, right? So those are important, but to your brain, it's like, dude, I don't care if those really suck or not. You can have problems in every joint in your body. I really don't care because at least I'm not dead today. Thumbs up. But if your lymphatic system goes kaput, you're dead in 24 hours. So your brain says, dude, lymph's way more important than that stuff. And so we work both. I'm going to work your muscle, your fascia, your joint, and your ligaments, and I'm going to do your lymph, and your brain's going to say, thank you very much. You figured it out. You got what I'm saying here. And the brain is number 1 because the brain, the most important thing to the brain is itself, right? I mean, it's very selfish. And we know that if the brain loses oxygen, especially, you're dead in a couple of minutes, man, unless you've been practicing how to hold your breath for a long time. And so it says the oxygen's pretty good, man. I need that stuff. So then that's where we work with the brain and inflammation and then vascularization. So when you come below the number 2, which is the lymph, we have the gut comes second. The gut comes second because it's so intimately connected to the brain. And then number 4 is vascularization. Blood flow, or what I call microcirculation. More so the capillary, the endpoint circulation, the capillary ones. And then we go deeper and we look at the circulation around primary pulse points in the body and aorta, how the aorta can function and move. And it usually you find some restrictions in the deep blood flow because you got such inflammation in the organs and they're not moving well because of so much inflammation. And all I do is this. It's very simple. When somebody comes in to see me, they got chronic pain somewhere, I know there's a problem with 1 through 8. And I'm going to take a look at them. But I'm going to go through those systems and here's the thing, I'm going to assess every single one of them. Every single one of them. That's why my initial visit is 90 minutes. I've designed my practice that way. I honestly have the luxury of being able to practice that way. Most people in healthcare today in the clinical world can't because they're in a system that sucks and they can't take the time to do it. And they got to do the best they can with where they are with what they've got. But that's why we're spinning out of control with autoimmune diseases more than ever before. And so I'll take the time and I'll go through all those systems and I'll find the system for you where you've got the most vulnerability. And then that's where I'm going to really begin to focus. But I'm always going to start and do work at 1 and number 2 because so the lymphatic system
control of the rest of the systems.
Exactly. So let's say that I'll do the lymphatics, right? So the lymphatic system is really important, but it's not unicorns and rainbows and the biggest problem in everybody. Like I'll check some people's lymph and then I'll press on the lymph nodes and I'll assess them there. And I'm like, they seem pretty good, man. I don't really notice any swelling or anything like that. And then they're not really, really tender. And maybe it's just a little bit sluggish, but I don't think it's the biggest problem that you got.
Yeah.
But they could have another issue where, oh my God, I'm trying to check your pulse points everywhere, and I can't find a pulse hardly anywhere. Like, I know it's really, really poor blood flow going in there. That may be your biggest one, right?
Mm.
So I'll go through and I'll just check off the 1 through 9. And I'm going to go usually for the one system I go after is 2 things I'm going to look for. Actually, 3 things. One, I'm going to go by your history and what you've told me up to that point of your life, because that's going to lead me to where I want to go, because that's usually where you find your answer. And it can be decades prior to you walking in my door.
Yeah, it's what happened before what happened, right?
Yeah, because your nervous system and your immune system never forget anything, even though you do. That's my joke, which means that, consciously you might forget a lot of stuff, but subconsciously your body never forgets, man. It's always spinning those wheels all the time. And so I'll go by what you tell me, and then I'm going to go by my assessment of palpation. I'm going to press on tissue and see if you don't like it, like if it hurts. I'm going to press everywhere, from your pinky toe to your freaking eyeball. I'm going to press everywhere, and I'm going to see if you have pain. And I know one thing: healthy tissue shouldn't hurt when you press on it. That's what I know. And I'm looking for a pain response. But not everybody shows pain, right? But they will show vulnerability in their nervous system, where they'll show where the nervous system will pick up some perceived threat on a subconscious level, and I'll see subtle things happening in your body language or your breathing or your eyes. So I'll be able to tell this. I'll be able to tell where your nervous system subconsciously doesn't want me to be. And then that's the place I go after the most. I'll go after the place that you have no idea your nervous system doesn't like. But I know it because I'm watching what you do when I go there.
So
most
subtle,
of the time it'll be
cues. They might move away from it or something like that. Not want you to go there.
Yeah. Oh yeah. You'll see a lot of sympathetic cues that can happen. A couple of them is you stop breathing is a big one. One, the eyes do a lot of different things. They'll blink really, really fast very often. They may look in a particular direction when you do that. Some people will begin to sweat. I'll visibly see signs of withdrawal that's happening. And we all have these cues built in us as human beings because we're social creatures, and you're supposed to be able to spot the body language of another person and see, is this person a threat to me or are they cool? Like you know right away when you get near somebody by reading their language. And most of our communication is nonverbal anyway.
Yeah.
And you're programmed to find that because you're programmed not to die. Like, you need to pick up these cues so you're not dead in half a second because you misread the cues and they were friendly and then they actually were not. And I'll watch those. And then when you start to study the brain and the vagus nerve, you'll come across some stuff by a guy named Stephen Porges, who wrote about what's called the Polyvagal Theory. And he coined a term, which is one of my favorite words ever and concepts. It's called neuroception. And neuroception is the subconscious intake of threat from your environment, inside and outside. That's very important that people understand that.
Yes, that's a big one, isn't it? People often think that the threats are coming from the outside, but oftentimes, I think it's like 80% of it or something, is the brain is actually perceiving threat within the body. But then
correct,
we think it has to be coming from the outside, but it's actually not. It's actually the sensory information pumping up into the insular cortex in the brain, and then we react to it, and then so we're essentially reacting to ourselves. Hence,
correct. And they call that interoception.
Yeah, interoception.
Yeah, that's coming from like within, right? And I love to talk about it because it's your thought processes too. I mean, some of the most toxic things you're ever going to put into your body is how you think.
Absolutely.
How you think about yourself. There's a big one, because if you don't love yourself, you ain't ever going to know. How you think about the world, how you interpret the world. That's your stress response, because everybody's is interpreting this pandemic thing differently, right? So it's that thought process of threat, but it's also the underlying threat that your nervous system is perceiving from this subtle inflammation that's around your tissues that you don't physically feel pain with yet.
Yeah.
So that's why I know if I put you on my table and you're like, Doc, I've got a lot of pain in my left knee or my low back or my right, insert body part here. I really don't care. Why are you pressing around my abdomen? Well, you're not asking me that question because I would have gone through the 1 through 9 by now. So you would have known what I'm going to be doing. But I'm going to press around that abdominal region because now we know that's where most of your lymph sits. That's where your gut brain sits. That's where a significant amount of blood flow and lymphatic restriction happens. That's also, in my world, where your emotional center sits. It's also the pivot point of your axis of physical rotation from the arms and the legs. And I'm going to slowly press in there. And 9 times out of 10, sometimes 10 times out of 10, people are like, holy crap, that friggin' hurts. Like, ow.
Yep.
And they had no idea that it hurt until I stuck my finger there. And then usually they say, why are you pressing so hard? And I'm like, it shouldn't matter how hard I'm pressing, and it should not hurt at all. Right? Like, it should be no pain. But here's the point I was trying to make, right? Is that consciously, you didn't know that that area hurt until I stuck my finger there. But subconsciously, your brain has always known that area hurts. And what it's going to do is it's going to find some way to protect that region. And one way that it can protect that region is to try to have that region not move so much. Or tighten it up for protection.
Yeah.
Right? And tight tissue doesn't accept blood flow well. Right? And tight tissue doesn't move well. Right? So then you're taking away the things that are going to deliver a lot of nutrients into your body and give you the thing that moves the lymph, which is movement as well. Right? So it goes into this protective strategy of immobilization. And then now with the current research, which I happen to agree with this theory, it's quite fascinating, is that there's an area that there's a lot of vulnerability or threat in there. It gets the tissue gets really, really tight. Tight tissue doesn't accept blood flow well. That means nerves don't get nutrients and oxygen, and then nerves lose the ability to sense things. Right? Yeah. So they can get increased sensitivity, but they can also get decreased sensitivity. But it depends on what part of the nerve you're talking about. But you lose sensory input. And we know
talking about mechanoreceptive or nociceptive.
Well, I mean, no, more so just in the sense, because everything's going to have like a nociceptive effect to determine threat, especially for your superficial cutaneous free-ending nerves, right? But more so from that sensory input from touch or awareness or mechanoreceptors, you could say that. Yeah. To being able to sense its environment where it is. Because it can't breathe. And then when nerves can't breathe too, it might turn up the threat response a little bit on the nociceptors, because nociceptors are not pain receptors, they're threat receptors.
Threat receptors, yeah.
So, and they're going to, trust me, if your nerves can't breathe, that's a freaking threat. I mean, I don't know what is not a threat, is where you can't breathe. And then it loses the ability to sense where it is in the environment, right? And then we know that sensory input drives motor output. That means your brain takes in sensory input to determine how it should move based on what it just felt or didn't feel. And so it loses the idea of where its quote unquote core is, or where any part of the body hurts. So now they're thinking that the brain actually starts to send pain signals to a region that it can't feel because it's trying to figure out where it is.
Yeah. It's trying to make it pay attention, essentially, isn't it?
There you go. Because trust me, you'll pay attention when it friggin' hurts. And then it also now knows where the body part is because it's always hurting. So it's actually a sense of awareness for the brain. And the fascinating stuff about this, man, is like you can see how there's a lot of different systems going into play, and we try to make as much sense of it as we can. And the kind of funny thing about science is that we get so much stuff wrong. It's not even funny. Like what we think is right
Yeah.
today is like, oopsie daisy. How the hell did we get that completely wrong? It's usually going to be proven totally wrong tomorrow. But that's just the process of discovery, right? And
Yeah.
because they used to think that the brain could not actually change itself at all, and now you're thinking, seriously?
Yeah.
And then they used to think that you didn't have lymph in your brain, and now you're thinking, really? Somebody actually thought that? Like, come on. And then my favorite phrase is this. I actually kind of hijacked it a little bit and changed it up. Anybody, if you're listening, do you know Neil deGrasse Tyson?
Yeah.
So he tried to make like astronomy available to the layperson, the average person. And he said something that I was like, dude, that's freaking brilliant. I'm going to hijack that. He said, the universe is under no obligation to make sense to you. Basically saying that I don't care whether you understand why it's doing what it's doing. The universe just keeps on going. And then I said, dude, the body is
That's
the
where you
most
got that from.
incredible. The body is the most incredible thing in the universe. We haven't even tapped it. So I said, I'm going to take it. The human body is under no obligation to make sense to you. And you need to keep that in mind when people are trying to say, can you justify this or that? I'm like, honestly, I don't think I really can right now, because I don't think we know why. And I'm going to curse now. I really don't give a shit. Like, it might not make sense to you, but if it works, it works. And if it doesn't work, it doesn't work. But here's the thing. Like, it's like discovering the lymph. It was always there. We just didn't see it yet because we weren't ready to see it yet, or we don't have the lens to see it. And that can be said for a lot of stuff that we're making changes in right now with the body, but we just don't understand why. And you have to be okay with that, honestly. Otherwise,
you don't know what
you're
you don't know.
Yeah, well, some of the greatest discoveries in science and in medicine happen by accident, right? I mean, like penicillin was that way, right? He just left it. He's frustrated. He's pissed off, and he comes back and he's got mold on his petri dish. Oh my God! How come I didn't think about that? Right? It's like something that just kind of comes across to you that happens to you that you can just start to. You have to think with a different lens, and then this is what I want people to think about: is like these different perspectives and different systems. And that's why I actually like being a generalist, because a specialist is somebody who knows more and more about less and less. And when you specialize, you'll tend to always get what you're looking for. And I like to be open for surprises and look at basics and fundamentals. And for me, that 1 through 9, that's kind of my basics and fundamentals. And then what I can do is then I can go down the number and specialize in the number, but I need to be able to actually see other numbers, if that makes sense. And then when you get the systems things down, you realize that with chronic pain or disease, people are coming to see you. Let's say it's a 20-step process. And then, let's say number 20 is you're freaking dead. Okay. And they're probably at 15, which means they feel miserable.
Yeah.
Or they have a symptom at 15. We start trying to treat 15. And you should. But what I'm trying to say is if you go back and look at these systems, you'll probably find the catalyst for 15 happened at number 2.
Yeah.
And there was some step missing at number 2 that altered what happens at 3, 4, 5, 6, 7, 8, 9, and 10 to give you 15. So if you don't go back and look at step 2 and fix that, then 15 never stands a chance of getting where it needs to be.
100%.
And that's the fascinating stuff to me. And I've just found, to try to make it a little bit more simplistic, if somebody comes in with chronic pain, autoimmune, or brain inflammation, I know that a step 2, your lymph's going to be involved in some way, shape, or form, that I need to at least check the box and make sure step 2 is doing okay. So that I know when I go to the next one that I've ruled it out, right? And this made practice so much more fun for me because I was really just kind of going through the motions. I was very humdrum. I was tired of just treating the site of pain. That's where Stop Chasing Pain came from. It was like, treat where it hurts, but don't chase it. Chase it means that you're just doing everything to it and you're just hoping something sticks.
It's still symptomatic treatment, still allopathic treatment, isn't it? It's sort of, as opposed to holistic treatment.
And this is where my journey, everything happens for a reason, right? Like, I'm so glad that I discovered lymph later, because I never would have discovered all the other stuff that I already studied. And so in the beginning of my journey, let me tell you what my thought process was. Like, I studied a lot of things with my mentors, Gray Cook and Lee Burton, and those guys who created the functional movement screen and the healthcare side of it, called the SFMA. And I was really into movement at the standpoint, dysfunctional movement and pain. And so let's say you came in with your right knee hurting, then I would be usually just doing a lot of therapies to your right knee. And then they came across, well, maybe you have dysfunction somewhere else that doesn't hurt, but the dysfunction is causing the knee pain. So say, for instance, maybe your ankle doesn't move well, or your hip doesn't move well on that knee side, which causes the knee to hurt. And I'm like, whoa, this is awesome, man. I had so much fun with that concept. Like, never even thought about it. And I started to do that. And then the concept was, maybe it could be coming from the other leg, because the two legs have to work together. And then I just started to have so much more fun because I got to look at things like a detective. But the thing was, I was still stuck in musculoskeletal contributions. Yeah, exactly. And I'm not saying that that's not important, but it is. But then I started to say, there's got to be even more and more and more. And then that's when I discovered all these other systems. And I try to look on the positive side of things, of like, everything happens for a reason. So I really honestly think now that one of the reasons I ended up getting really sick and getting an autoimmune disease is because I had to get kicked down to the ground to come to a point where I was open to seeing things a different way.
Absolutely.
And like the universe telling me, this is how I like to talk to myself. Like, Perry, I'm going to kick your ass pretty good, man. I'm going to take you down for like a year or two. It's going to be rough. It's going to suck. But I know you're strong enough to come out of the other side because you're resilient enough. And then whatever you learn, I know you'll probably take it out there and try to teach it to somebody else in your own unique way. So here it comes. And I really believe that, man. And anytime I've spoken to anybody who's come back from serious illness or serious pain and they've come back, they've always said to me, I honestly would never exchange it for anything.
Yeah.
Because it made me into a person I never thought I could be. It showed me how to see the world I never knew existed. But it also was something for me. I get emotional a little bit sometimes still. It taught me something I never really think I truly had before, which was empathy. Like, I saw things that other people were suffering with, they're going through, that I never really noticed before. And so many people I noticed afterwards, like, so many people are sick, man. So many people are not well. And we're not supposed to be living like this.
No.
We're not. And they're lost, and they're looking for answers or hope, and they're not getting it. And it was almost like a universe thing. And I always say, it's like, you ever bought like a car, and then when you drive it off the lot, you're like, holy hell, how did everybody end up with the exact same car? Like, they're always around. You just never notice it until you got one.
Yeah.
And it's the same thing with my illness or my disease that I had. And I was like, oh my God, it's everywhere.
Yeah.
And I just refuse that nature or the universe or whatever being you want to believe in designed us to suffer like this. I mean, we should suffer, because life without suffering would be freaking boring. We're not supposed to be in the comfort zone all the time, because that's how you become stronger and more resilient through adaptation. That's why I think with this pandemic, we're going to come out stronger and more resilient and more connected than we were
100%.
before.
100%. Yeah.
But
take all right from
because you never learn through comfort, you only learn through discomfort or like a big ass kicking, and it's what you do with it after that, right? And I think that that it changed my whole perspective on looking at things. And I never would have found the lymph. I never would have found the 1 through 9 perspective. And it's going to evolve for me too. Listen, I'm always learning. I'm just so, I mean, I'm like a neuro geek like you, man. Like I'm so excited with what we're going to be learning about the brain in the coming years, because what we've learned even just over the last decade has been more than we've learned over the entire history of the world. And what is also very humbling is we were wrong with like most stuff we thought, and until we could actually see how things are actually working in there. And I think it's just going to catapult us to, it's like, if you look at the technology of the world, like we didn't have these handheld smartphones for most of our life. And then we get one like 5 years ago, and look how far we've come with what you can do with a freaking phone.
Yeah, that's
and
phenomenal.
Then now with technology for the brain, like 5 years from now, what we're going to be able to see or do. And it's my hope, honestly, that with Western medicine, that we've got new ways to discover what's going on and why the body might be doing what it's doing. Yeah. I can tell you that there's one thing I would really like for Western medicine to be able to change. Anytime I've ever seen anyone talk about they found a new discovery here or a new link here or a new enzyme here, every single time in the article, they're always talking about a pharmacological solution. It's always a freaking drug that's got to be the answer. And I'm like, why does it have to be that? Why don't you go back to other things that we're learning now in relationship to, I think I know the most powerful drug in the world. 1 is how you think. 2 is what you put in your freaking mouth. That's the second one.
Yeah.
Right? So what you eat makes a huge, huge difference. So there's no reason why you can't have the drug, because I don't want people to suffer. But why don't you do the other stuff with it? That's a really novel idea. Like, how about you mix it all together? And here's the fascinating thing, man. I know I'm going on, but like I had thyroid cancer about 16 years ago, and they removed my thyroid gland and a pretty good amount of lymph nodes in my neck, which should have been my first clue 15 years ago that I had toxicity in my body enough to let cancer take hold of it. But it only manifested 10 years later with the autoimmune disease, right? So they took my thyroid gland out, and because of that, I have to take medication, otherwise I'll die. So I need levothyroxine, which is a type of synthroid medication. And they have to play with your dose, right? You got to get the dose for your size or whatever. And I was taking up to 325 micrograms of levothyroxine. And since I cleared my lymph, which means I got rid of the toxins, and when I cleared I actually lost 30 pounds in 1 month. But it wasn't just 30 pounds of fat; it was 30 pounds of inflammation and swelling,
metabolic
and
waste
as well.
Yeah,
right. And then you'll discover too that fat surrounds toxins, so people will be heavy and obese or have a very difficult time losing weight when they're toxic. And so I lost 30 pounds, which was a nice cosmetic bonus, but I also felt really good. But here's the thing that happened. It didn't happen with that first month, but probably maybe about 3 to 4 months later. They had to drastically reduce my medication, and it's probably 2 years later, it's even lower. I was at 325 micrograms to get my levels where I need to be on blood work. Now I'm at 200. So I had to think about that for a moment. Why would that happen? Well, maybe, just maybe, I'm making an environment with my cells that are more conducive to absorbing the medication that I'm introducing into the system to get the desired effect with a lower dose. Because I was so toxic before that things couldn't cross the cell membrane, or I couldn't absorb the medication, and my liver was overloaded, that it took 325 to get the response. But now when I do the drainage precedes supply, even for supply of drugs, that I needed less medication. And dude, that's good because medication always has a side effect to it. And I need less of that to get a desired effect.
Yeah.
Or maybe I need less combinations of a lot of different drugs because many people are on multiple meds. I get some people that are on 10 meds or more.
Mm.
Like, that's on the low end too. You see,
and you're always working with the meds, so they can be hampering the process, you know.
Yeah, and then the meds will have their own interactions with each other, right? And then you like cross reactions, and sometimes you have multiple physicians that are prescribing here, and the other one might not know what they're doing, or they have multiple pharmacies where they're not tracking, and they're giving you this to go up and this to go down, and you got to be careful with. It's a lot of this stuff like this that interacts together, and then sometimes we don't even know what happens when this drug goes with that drug. It makes some new freaking combination that none of us ever heard of before. And that's what happens with toxins in our environment, where we have, I can't tell you how many thousands of toxins that we're exposed to. And then if the government, because I'm here in the US, or the FDA, I mean, if you trust them enough to even tell you the freaking truth, because it's money driven, that this is a safe level for you to get of this, or this one is deemed okay for human consumption, which is probably BS. And then it's okay. I'm like, okay, but what if I'm combining that with this one over here that you said was okay as well? They're okay when they're separate. Yeah. What if I put those two suckers together? Like, there's going to be some quantum chemistry freaking reaction in there that you didn't anticipate that my body now has to deal with and say, seriously? This is what you're sending at me? And so there's no way to know what's going on in there. Because if you walk into the supermarket and you pick up a box, I could pick up 5 different boxes in there, and you can read a box, and I bet you can't tell me what the freaking product is because the box all looks the same, right? So it's just not real food. It's artificial food. And then all that stuff that you're putting into the body, that's the only thing that your body has to use to make new cells. That's it. Like, you're giving it that material to make a new cell. But if I give somebody and I give them an avocado and I say, can you name this food for me? Yes, it's an avocado. Good job. So you know what you're getting. Meanwhile, I'll give them 5 boxes and I'll cover up what it. Can you tell me what this is you're eating? No, I got no idea.
What does it do in the body? Yeah.
Oh my God. Well, think about it. Now, if you go back and you look at the industrialization of the world and the way that we've mass produced food, and you got to make it available for cajillions of people. It's got to last transport. It's got to be able to look good on the shelf. Because I got to make money, man. And then those you're investing, taking in all those things, and you're taking all those in, right? And not to mention that food, when we do grow it, is in soil that's nutrient depleted, and you're not getting the same nutrients that you used to get in the first place. Or in the world that we live in, it's so expensive to eat healthy, and the people that need it the most can't eat.
No. It's ridiculous.
I can go get 2 Big Macs for like $2, and you're gonna charge me $7.99 for 2 avocados? No, I can't do it. That's the batshit crazy world that we live in.
Yes, totally agree.
I'm getting worked up now.
It's good, man. It's good. It's coming through.
Well, I always tell people this: you cannot get well in the same environment you became ill with it.
Yeah.
So we have to think about that. Well, what's contributing to your environment? Everything that you're doing around your life, how you think, your habits and your behaviors. And here's the thing: is that it's almost impossible to avoid that. Like, you're breathing in toxins no matter what you do. You're eating stuff. It's hard to eat well. It's almost like I am amazed that anybody is alive at all. I kid you not.
It shows how resilient we are. The body
just shows you how amazing the human body is, right? Like, of what it can withstand before it starts to break down. And it's always trying to fight for you. Sometimes it might not feel that way, when you're breaking down.
I've heard a good saying is like, you have to work pretty damn hard to get sick. Like, you have to work pretty hard at it. Like, you know what I mean?
Yeah.
It's an effort.
It's also an effort to get well.
Yeah, exactly.
And, I mean, I tell people all the time, being healthy is not a right at all. It's a blessing. It's so you can easily break down. It takes work to keep you healthy. It takes a lot to get you there, to back to it.
Yeah, and it's a consistent lifestyle thing too. People often think they just get to a certain point, they get better or they get not sick, but they don't keep going with it. They don't become more vital. They don't continue the process of evolution of getting healthier and healthier and healthier and more vital, right?
Yeah, well, I love the word vitality, because in our culture, at least now, hopefully it's changing, but as long as you don't have symptoms, you're healthy. That's the way we look at it. But I look at that, the symptoms that people are presenting with, that everybody walks in with, that means they're not healthy, right? All those things that people check off on boxes and that we deal with, and everybody's got them, and it's just a normal part, or they give you this absolute bull line of you're just getting older. Those guys should be gut punched, first of all. That's ridiculous, because the body's designed to regenerate and to heal, and you should be getting better with time, not worse.
Yeah.
So if anybody ever tells you because of its old age you need to find a new person to work with, that's the biggest piece of advice I can give you.
Or it's all in your head.
Yeah, the funny thing, that's about the only thing they got right, because we know that they don't even know they're right. They think they're being, it's all in your head. Like, dude,
I think you're making it up.
It actually
is all in your brain.
Yeah, it is. Now that we know about that the thought processes and how that influences the body, right? Or now when science says that pain is in the brain and pain is all perception, and it's not related to physical damage to the body in any way, shape, or form. So it actually is in the brain, and many people aren't ready to grasp that fact, because they're like, I don't understand how that could be, that it's in here. But it's very, very powerful when you can learn to change and alter your thought process or your perception of something. I think you probably know who Lorimer Moseley is, right?
Yeah, definitely.
With the NOI group. I mean, he's kind of like the wizard on top of the mountain with the
pain science. Yeah, and he's Aussie too. He's from Adelaide.
Oh, awesome. And he gave a great example that I'd like to give here, that puts it in perspective for people when I tell them. It's like, okay, because he's from Australia, and there's a lot of things over there in Australia that can kill you, right? Like poison things. He said you're walking out in the bush, and you're trudging along, and you feel a scrape on your leg, and you reach down there, and you got like a little bit of, ow, what the hell was that? And then you look down there, and there's a briar brush, and you got a little thorn in there, and you just, that sucked. And you just keep walking, right? You're walking off, and you got the sensory input for pain. And then he said, okay, here's scenario B. You're walking along, you get the same exact sensation. Then you look down there, and now you see a snake. All of a sudden, that hurts way more. Because one's a snake and one's a thorn. Your reaction is going to be vastly different based on your perception of what inflicted the sensory input.
Because to your brain,
and I'm like,
to your brain, it knows that a snake through evolution is really dangerous, so it'll start to fire up the pain receptors.
Yeah, and then it's going like, hey, there might be some poison heading somewhere, like not good, as opposed to the other one where, that's gonna leave a little scar, like that way. And at that time, when I heard that, I was like, man, that's a brilliant way to put it. And then when people hear that, they go, that makes so much sense, right?
Yeah, no, he's definitely a great mind in that field. So we're probably going to have to wrap up soon. But is there any wrap up like shortly? But is there any like advice you have for people regarding, how to manage their minds and stay positive and you know, hold strong through this very uncertain period in humanity. Is there any sort of advice you have for people and how to look after themselves?
Yeah, well, that's a great question. Well, I mean, it's very interesting, right? So much of our world has been on this nonstop go, 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 go. Like you just never slow down. Right? You're in this like type A personality, sympathetic driven, or just always some stimulation coming in somewhere, and you could never find the time, for instance, to have some time to yourself or do this or that. And then now people have got that time. It's almost like they don't know what to do with themselves. And
Mm-hmm.
it's interesting with my perspective too, is that sometimes the nervous system has kept you in that go, go, go mood because it's not ready for you to slow down yet.
Mm.
Because when you slow down, it knows you're going to have to do a lot of introspection and thinking. And you might crash and burn because emotionally you got some deep stuff going on. And your brain's been trying to keep you in the go mode because you're not ready for the quiet mode. Um, a couple of things. One, work your lymphatic system. That should be a really nice one. But two, definitely start to do some movement. So I tell people a couple things. They always say, what type of movement? I'll give you my favorite in a moment. But I talk about what's called 4M motion. That means move more of yourself, more often, more ways, and more environments. Otherwise known as put yourself in different situations of movement that you normally wouldn't do. It's called variety, variation, or variability, or in our world of the brain, it's called novelty. Give it something different, right? And then as long as you have some fun when you do it, is another big thing. But probably one of my favorite ones that I've gravitated to and I turn people into is internal type of martial arts practice where I like to do a lot of circular type motions, and I Tai Chi and Qigong and those types of things work really, really well.
I did Qigong before I had this chat. I've just started doing it again in the last few days. I used to do it 20 minutes in the morning and evening, and I'm just like, yeah, I'm definitely getting back into this. It's so powerful for the body and the mind and the lymph as well. It moves everything.
Right. It is. It'd be hard for people in the beginning because, it takes a lot of intention and it's quiet and you may only get like 2 minutes in and you'll want to quit. But, you'll work your way in. But you can also start to do the movements and have just a little bit of extra tension on your body when you do it. So you feel like you're a little bit more engaged. But that's probably some of my favorites. But then also getting into what most people have probably heard about already is just kind of get your breathing under control a little bit better. And I tell people a very simple one is just start to pay attention and breathe throughout the day more through your nose than your mouth. Because when people get under stress or anxiety, they mouth breathe a lot. Like this way, because it's like having like a panic attack, like this way, and then they don't even know that they're mouth breathing. But if you breathe through your nose, well, that's a very, very big, powerful thing to do. Because when you breathe through your nose, you automatically get more movement in your diaphragm, which moves the lymph and moves the organs.
So it goes back to that cerebrospinal pump you were talking about before.
Exactly, and it's an easy way to start to move it. But you also improve the ratio of carbon. The part is good. We'll just do the breathing through the nose.
All right, so we just had a little bit of a technical difficulty there, but we're just going to jump back in where we were. And like Perry, you were talking about how important it is, like as a health strategy to keep yourself healthy amongst all the craziness that's going on. How important breathing through the nose is.
Yeah, exactly. So we have the movement part, right? Moving more of yourself more often, more ways, more environments. And breathing is really a big one. But I try to make it very simple for people to say, just start to try to pay attention to how you're breathing throughout the day. And even at night, I'll get into that in a moment. But breathe more through your nose than through your mouth. Most people breathe through the mouth.
Yeah.
and the nose, especially when they're under stress, because they get anxiety like this. They get a little bit of a panic attack like that. And when you breathe in through your nose, a few magical things happen. One, you're going to automatically get more oxygen to the lower part of your lungs where most of your red blood cells sit and actually are made. So you'll get more oxygen into your body.
Mm-hmm.
And we already know how important oxygen is, right? So you'll get more of that. But when you breathe through your nose, you'll automatically increase more pressure in your diaphragm, which will descend further down. And then it will move your organs, but it'll move all that fluid we've been talking about.
Yeah.
So you'll start to get more movement in your lymphatics when you go through the diaphragm, which is a great a great thing as well. And so it also will change the ratio of carbon dioxide to oxygen. So you'll get more oxygen release into the system. And that's really, really important in relationship to the cells of the body being able to heal, like you said before. And just paying attention to that during the day, you may notice like, wow, I mean, I can't believe how much I used to breathe through my mouth. And then at night, most people breathe through their mouth without realizing, and I know I did. And you can do a technique that I learned from several different people, but
mouth taping,
tape your mouth shut at night, and you can wake up very invigorated the next day because of the change of delivery of oxygen. And then when we cycle back to that pumping mechanism of your brain and your spine, when you breathe through the nose, that increases that pressure mechanism. So you'll actually drain the toxins from your brain more efficiently when you breathe through the nose as opposed to your mouth. So it's like it's like a win-win. I mean, so you're decreasing stress, one of the most simple ways that you can. And then it's also, you want to carry over that to exercise. So we mentioned before about trying like Tai Chi or Qigong or some movements. Really pay attention to nose breathing the whole time, not through your mouth, which is really challenging for people. Because when you have a poor oxygen delivery in your body and carbon dioxide and inflammation, you'll find that you'll gravitate towards mouth breathing like really fast.
Yeah.
And then what happens is that you tend to overbreathe. And when you overbreathe, you're going to change the acidity level in your body. And you're
100%.
To physical pain.
It's interesting because one of our practitioners for the retreat, Dr. Natasha Fox, she's in functional medicine and Chinese medicine doctor, and she did a lot of research we did one of the lectures was on breathing, and she talked about the exact same things about taping the mouth, breathing through the nose, and how that affects not only the pH balance of the body, but the whole interstitial system of the body, so all the fluid systems of the body. And I was saying like 80% of health just from doing that, just from nose breathing.
Big time. It's huge. I mean, it's amazing. It's done wonders for me. I mean, I've been mouth breathing for decades, and it's really funny because my children would always snap pictures because I used to be able to fall asleep. Like if you're talking to me, I can fall asleep, right? And then I could be asleep in no time, and then they've got pictures of me on the couch or on airplanes, and my head is back, and my mouth is like wide open, like this. And it was funny at the time, but until I realized, dude, that's not funny at all. Like, I mean, I need to be able to close this thing down. And when I started to do that at night, it made a huge difference for me. And I got a little anxiety in the beginning because of closing it. Some of it was just like the feel of it being closed, and then feel like I wasn't getting a lot of oxygen. So people that are listening, you may have to like tiptoe into this because it can sometimes be emotional. It cause emotional anxiety when you begin to do that.
100%.
Start a little bit before you go to sleep to see how comfortable you are.
Yeah, usually what I do before to bed, I do have a little sequence. I'll actually just sit up and I'll do like the alternate nostril breathing one. So 5 seconds in and out each nostril. Then I'll just do like a parasympathetic breathing. So I'll breathe in 4 seconds, hold for 6, and then breathe out for 8. And that sort of just gets me into parasympathetic land. And then I'll just do 6 seconds in, 6 seconds out, all through the nose. And if I do that, I usually just sleep really well, or wake up feeling rested. It's crazy. So
yeah. It's amazing. Well, it's something I always try to tell people is if I know people are struggling with chronic pain or any type of health issue or even a training issue where they're trying to go harder, faster, stronger, longer, and they're not making progress. I usually 99.9% of the time is because there's a basic or a fundamental somewhere
Mm.
that has been overlooked or it hasn't been paid the attention that needs
Yeah.
to it. And that's sad because people get bored with the basics and they want all the flash and the glitter because they think that that's where they're going to get their monster mode from. But it always ties back to martial arts for me because it's taught me so many things over the years. Is that any great master will always hammer for you to go over the basics and the fundamentals. It's every
100%.
great karate movie ever made where you get the cocky student who wants to learn the spin kick, and meanwhile he's doing the katas over and over and over, wax on, wax off, sand the floor, paint the fence, right? Like you're just like, can you show me the good stuff? But you don't realize you're getting the good stuff.
Yeah.
At the
It's all the
same
basics.
time, it really is. And if you can nail that, but if you follow the elite, like the best of the best, you see that they're always going back to the basics, but they're always trying to improve the basics all the time.
Yeah.
You don't hit this thing where you're like you get good at the basics and then you go back and do the basics just to do the basics. I mean, you actually really have a lot of intention behind the basics. Those are the ones that make the performance on the field look effortless, and that they're the people that are you want to try to emulate, but you don't see all the hours of the effort and dedication and hard work
Painstaking.
to it to make it look that efficient.
I remember with that when I was in the army, and when I had a chance to work with our elite special forces, the SASR, and I spent a few months with them, and all they really were was exceptional, absolutely exceptional at the basics. They had just had them dialed in. So then they could layer on complexity because they had the basics down pat. So,
that foundational pyramid, right? That you have to go back to, and that's what I do with my fundamental movements all the time, and it's done wonders for me. And then that's kind of like the basics of what we were talking about before. To me, a fundamental basic is the lymphatic work is definitely a big one. That the lymphatics, man. I mean, that's my deadlift right there. That's like, yeah.
All right. So you have shared some awesome knowledge and wisdom, and covered some really good stuff. And like the way you speak about it is, I think it's a way that people can understand as well. It makes sense, makes logical sense, and it's intuitive as well. I really love how you speak about it. It's really informed and helped me along my journey. So hopefully it can help some of our guys that are watching this. I know you have a massive presence online. You have a website, you have Instagram and all these social. Instagram is really good. It's very active, and you have a lot of followers. And so, how do people get in contact with you or learn more about what you're doing with your upcoming courses, and probably going to be online courses up, I'm imagining now. So, how do they get in contact with you?
Well, yeah, thank you very much. It's very simple. I'm easy to find. If you type in "stop chasing pain" on any search engine, I'll show up, and that'll take you to a lot of things that I've done. I mean, I've been in the trenches for a long time, and it'll be cool because you can see my evolution of how I've thought over the years. When you go back, 3 or 4 pages back in. But Stop Chasing Pain is my primary site, and when you go there, you'll see links to all of my social media outlets. And I do spend probably an unhealthy amount of time on Instagram, honestly, but I love it so much. It's very fun. It's got great energy. It's the one place that I'll probably share most of my content. And then when you go to my website, you can see from there my membership site, the workshops that I have, then the videos that you can purchase at the same time, and then of course my own podcast. And I think that we're all trying to adapt to what's going on in the world. There'll be some more because my membership site has close to 900 videos on there, so you can
Yeah.
keep busy for a while.
It's pretty
But
awesome.
I'll have some. Thank you, I appreciate that. I'll have some new webcast things coming up in the future, and we were heading towards that way anyway. Honestly, for this year, but the whole world going into chaos kind of put that. Like if you, might as well do my podcast now because I'm home.
Got the
The
time.
same thing with this one.
Opportunity. Necessity is the mother of all invention, they say.
It is. It's like, I think we're going to probably have some fantastic discoveries of changing the world when people get to slow down and think about things that in a way they've never thought before. It's crazy what the human mind can come up with when it's put in that type of situation.
Yeah. All right. Thanks, mate. Thanks heaps for your time, and look forward to watching your stuff online and hopefully seeing what's coming up for you on your webcast. So thanks, mate. Have a great day.
Thank
Thanks
you
for giving me the time, and speak to you soon. Cheers, mate.
You got it. Bye, everyone.